You're welcome back. It's the AM show on the Joy News channel. We're live on our multi-TV channel on YouTube, so make sure you take us with you wherever you go. So coming up, we're definitely bringing you the Joy News agenda. We will also make sure that we give you an update on the National Science and Maths quiz. There'll be showbiz news later as well. But Mamavi Owusu-Aboagye has been speaking to the Minister for Zongo Development, and we're going to bring you a conversation with him later on the show. Also, we'll be bringing you a conversation with Clement Apak, who raised an urgent question on the floor of Parliament regarding the deportation of some Ghanaian citizens from the United States. This, of course, has sparked a statement from the United States Embassy here in Ghana. We'll bring you details of that conversation. But first, do you know the standard of care to which you are entitled when you go to a hospital? How would you know whether the medical professionals handling your treatment are meeting or falling short of the basic levels of service you deserve as a patient? Well, I thought these questions should not go unanswered, and so I went to the one place responsible for ensuring medical professionals are working to these standards. I'm talking about the Medical and Dental Council. Here's a conversation I had with their registrar, Dr. Eli Atikpui. If you are strolling through the news headlines, you can't take two steps without tripping over a story about a medical facility or a hospital or a doctor or a patient. Somebody being accused of doing the wrong thing or causing the death of someone. Medical negligence and malpractice is preoccupying our minds as a nation in these recent days, and it's important for us to get educated on what exactly constitutes negligence, what exactly constitutes malpractice, and whether or not the stories we are engaging in the media actually point to that. Today our conversation is with the registrar of the Medical and Dental Council, Dr. Eli Atikpui. Thank you for having us.
You're welcome to the Medical and Dental Council.
Let's get started. Yeah. First, perhaps we ought to define a few things.
Yes.
We're all throwing around the words medical negligence and malpractice, but I wonder if we're using them correctly. What exactly is negligence? What exactly is malpractice?
You see, negligence, we can't really push it only to medical negligence. There is a general definition of negligence, and then we can now narrow it down to medical negligence and malpractice. So negligence basically is that you owe somebody a duty of care. You breach that duty of care, and that breach had caused harm. So that really defines negligence. So medical negligence is that, yes, you are a health professional, you provide medical care. Then you breach in the course of whatever provision of medical care, right? You breach that duty of care that you owe that individual, a patient, and that breach causes harm to that patient. Then we can establish the fact that that is medical negligence. Now, with respect to medical malpractice, there are several components of medical malpractice. An individual is supposed to do something, and that individual has not done it, or either an action or inaction of that individual, could be defined as a medical malpractice. But again, we try to define it in the course of provision of healthcare or medical environment. So your action or inaction, right? And that could also may have resulted in harm or otherwise, then we can call it a malpractice. For example, we haven't looked at that theoretical aspect of it. If you even go to a hospital and then an individual extorts money from you in lieu of providing you with a service, in that case, that individual has not breached that duty of care. The person is extorting money from you. So that is a medical malpractice. So at the end of the day, right, you go to the hospital, I need to provide you with a service. I have not even provided you with a service, and I'm asking you to pay for something which you are not supposed, to pay for. That is a medical malpractice. So I want us to really get the differences. That one, you owe the person a duty of care. You breach that duty of care, and that breach has resulted in harm. Then at the end of the day, we can define that as negligence. A malpractice is that, yes, an individual is supposed to have been provided with some sort of care. Either your action or inaction, right? Or you're doing things that you are not supposed to do, and then you may either have caused harm or otherwise, then we can say that there is a medical malpractice.
So, for example, being a doctor, you are supposed to work to certain standards. So educators, if a doctor sees a person who appears ill, does not examine that person, and says they must go to a different facility because they do not have beds, on the face of this, without any specific detail, just on the face of such a situation.
If we're going to look at it as a hypothetical situation, then we're going to say that, yes, I have entered your institution seeking for health care, and I have not been examined. I have not even been spoken to, and I'm asked to go away because there is no bed, or because something had happened. It really is something that is untenable. Because you see, you will not just get out from your house and walk into a hospital for the sake of it. The hospital is not a bar. The hospital is not a hotel for you to go have a drink. So unless, of course, maybe you have somebody on admission in that particular hospital and you are going to visit that individual, you go into the hospital. But as an individual who is not feeling fine and wishing to go receive care in that particular institution, the mere fact that you have moved from your house, identified a particular institution, knowing very well that you can seek and obtain health care from that particular institution, that institution is duty bound to at least speak to you to know exactly what is happening to you. Now, there are referral systems so that if the individual takes care of you or examines you and realizes that your condition is above the capacity that they have in that particular institution, they would have to send you to the next institution. But the issue is, I have not even come to speak to you. I have not even identified, there are 3 people seated in a vehicle. I have not even identified a sick person. By the mere fact that a vehicle had pulled up and somebody comes out of the vehicle and say that we have brought you a patient, at least standard practice requires that get close to the patient, see what is happening to the patient, and then determine whether or not you have the capacity, whether beds are available or beds are not available, for you to refer the person to the next level. So by the mere fact that an individual comes there, you have not gone to even speak to who the patient is to ascertain what the situation is. No bed. Or you see, I wouldn't want us to narrow it down to no bed. We are talking about the facilities that are available. It could be that maybe the practitioner who was supposed to have been there wasn't there at that moment. And therefore, keeping you there for the next 1 hour was going to create a problem. So the practitioner at that moment is not available. And therefore, the care that you need at that instant time is not available. They can refer you. But again, there will be the need for whoever is available to at least examine and know as to whether they can even give basic care before referring. Now,
as a medical and dental council, you've been in existence for many, many years. I am curious.
Since 1972.
Indeed, before I was born. I am curious. How many of such cases have been brought to you? This hypothetical case we discussed, a patient coming to a facility, not being examined, sent away.
Unfortunately, you see, per our provisions, you see, you make a complaint, haven't identified a doctor. So at the end of the day, if you go to an institution and the patient is sent away without any records and all that, you would not even have any practitioner to really make a complaint about.
But it is fascinating to learn that this phenomenon, which has now even gained a name in Ghanaian lexicon, no bed syndrome,
Yes.
no one has ever been reported for that, in your time at least.
No. I mean, we haven't had any report from anybody with respect to this issue of no bed syndrome, even though we have had cases haven't come and gone with respect to issues of no bed syndrome. I mean, the no bed syndrome is a phenomenon that, we've been aware of over a period of time, right? And I wish to indicate that there had been informal reports, discussions in the medical fraternity, discussions at meetings as heads of agencies and all that. So this particular case, I wish to indicate that, it is a case that has been reported. There had been cases that we have heard of informally. Yep, that's what I mean.
Right. That is a great way into this document I've been looking at, which is the law that defines your existence, if you will.
That established the Medical and Dental Council. Yes.
Health Professions Regulatory Bodies Act 2013, which is Act 857. Yes.
Yes.
You are very conversant with it.
It is the act that really, like you indicated, defines our existence. Yes. Without this act, there wouldn't be any institution like the Medical and Dental Council.
Indeed. And of course, within this act, there is the specific provisions that relate to the Medical and Dental Council.
Exactly.
And 26 actually speaks to the object of the council. It says the object of the council is to secure
in the public interest the highest standards in the training and practice of medicine and dentistry in Ghana.
Indeed. You've got it engraved on your heart.
No, but that is the work I do.
That's right.
That is my daily job.
Now, this is where I get curious, because you've indicated that you're aware, even though the reports have largely been informal, that no bed syndrome exists. You've been aware of its existence. Yep. And of course, this syndrome kills. People have died as a result of it.
I agree with you.
And your act also gives you the power. And I love the language here. It says that you are to secure in the public interest the higher standards in the training and practice of medicine and dentistry in Ghana. So if you are hearing all these anecdotes about doctors, medical professionals in practice sending people away because there are no beds, not examining them, and you are a body that has the power to inspect and sanction those who do wrong, to investigate and sanction.
Yeah.
Have you ever launched an investigation into the no bed syndrome?
You see, I had indicated earlier that we have had discussions, or where issues would have come out from discussions where we meet as healthcare providers and all that. But you see, our council works with specific rules and regulations. Invariably, there's supposed to be a formal complaint, right, from A or B. Without the formal complaint, we are limited. You see, because we have various stages of our investigations. The first one is that we have what we call a penal cases committee that does the initial investigations, and then it refers the case to the disciplinary committee in the event that, a case has been established against the practitioner, where we go in to have a disciplinary hearing. At the disciplinary hearing level, charges are preferred and we bring in witnesses. Now, if we do not have a formal complaint, how do we proceed at a particular level? However, you see, an impression is being created as though, you know, haven't heard of this no bed syndrome, nothing has been done over the period. I mean, if you go to, if you follow through over the period of time, you would have noted that a number of things had happened, you know, since issues started coming on this issue of no bed syndrome. And I will tell you that it is really unfortunate this case that everybody is talking about should come up. I mean, there had been a lot of meetings, there had been a lot of directives that were previously issued and all that. Some protocols were previously developed. And then, unfortunately, for reasons I wouldn't want to talk about now, because I had indicated that committees have been formed for them to investigate, to know exactly why this condition or this syndrome still persists. So I would wish that, you know, we really do not talk so much about a case that had happened and it is being investigated at all levels. The minister has set up a body to look at that, and the Parliament of Ghana has set up a body to look at that. The Ghana Health Service has set up a body to look at that. I mean, at various levels, and various institutions have been directed to provide some reports. So it would be premature for me sitting at the Medical and Dental Council trying to interrogate this particular case of no bed syndrome as we relate it to the unfortunate death that we have had.
So let's stay away from that specific case. I think you are right.
I'll be grateful.
You're right about that. But I still want to talk about the syndrome as a general concept. You have indicated that your council has in the past looked into this matter. You have put out guidelines to help medical professionals.
Not the council. You see, I want us to look at how the Medical and Dental Council operates as the other agencies under the Ministry of Health also operate. And you see, when we're saying that we have discussed at various levels issues of no bed syndrome, we would want to look at the people who are there, who are providing the service, to see whether strategies have been adopted to really solve this problem of no bed syndrome.
So at a sort of an interagency
level, which really is headed by the ministry, because all these agencies that we continue to talk about come under the Ministry of Health.
Right. Yep. Okay. So what were the findings when you looked into it?
You see, I'll tell you that, you know, there are various things that contribute to what we can call that no bed syndrome. In actual terms, certain situations, there will definitely be no bed. You see, but again, I wouldn't want to say that if there is no bed, that is why you should not even speak to the patient. You know, I would want us to understand some of the issues. There is no bed at the, okay, we call it the casualty or the emergency or the accident and emergency. Are there other alternatives in receiving the patient and assessing the patient and providing the initial care? So these are things that we would have to look at, or we had looked at. Yeah.
So generally, you found that there are some instances where there are no beds, but even then, there are alternatives that a facility can explore to provide care to a patient.
That is so.
Okay. So really, there should not be an excuse for no bed syndrome.
You see, I would have wished, you know, we were talking about this particular issue after all the investigations were done.
Fair enough.
So I will still continue to insist that let us shelve discussions on the no bed syndrome. Let us have all the investigations done, and then I know the minister will come out with a press briefing to really provide the information that will be required.
That is fine.
Yeah.
Let me ask this. You were indicating that it's difficult for the Medical and Dental Council to act on any issue without a formal complaint.
That is so.
But help me to understand what the legal position is. Is it that the Medical and Dental Council cannot embark on any investigation without a formal complaint? Is it that legally you cannot do so?
We cannot do so if there's no formal complaint to the Medical and Dental Council. It is explicitly stated in the law. Unfortunately, you see, this law came in 2013.
Yes.
And I did indicate that, you know, we had the earlier law, the NRCD, right? The Medical and Dental Act 1972, NRCD 91.
Yeah.
But again, this law, there is a savings, I think, section 52, where the disciplinary component of the earlier law had been saved. So if you go through that part of it, you would have noted that there's supposed to be a formal complaint made to the Medical and Dental Council. It further goes to indicate that whoever is making the complaint needs to support that complaint with a statutory declaration, unless, of course, that individual is a board member or a public officer, a public servant.
Okay.
So there are rules and regulations that govern, you know, the making of a complaint and how we deal with the complaints at the Medical and Dental Council.
Okay. No investigation without formal complaint.
No.
Okay.
Even if we pick up an item in the news, the law requires that we would even request, like tomorrow, if there's an issue, and then we pick it up in the news, we will come requesting you or your institution to make a formal complaint to the Medical and Dental Council.
Have you made any such request in,
yes,
in recent
recently,
times?
I think sometime last year, there was an accident and a patient or two patients were taken to a particular hospital. And unfortunately, the limbs of the patients were amputated. And then it came out that that was done without the consent of the patient. It came up in one of the media house or the radio stations and others, and then we picked it up. Immediately we requested that that institution made a formal complaint to us. They did, and we started the investigation, and it is ongoing. So issues can be picked up, you know, from any of the news items. However, once they are picked up, we'll request that that agency makes a formal complaint to the Medical and Dental Council. And you see, the issue is that we try to educate the institutions that it does not mean that because you are making the complaint to us, we're going to drag you along the whole line of the investigations. No. At a particular time, we might not even need you. But once you are an interested party, you know, you could come in as and when you wish.
I want us to talk about a case which is not under any investigation of any court or any regulatory body.
Good.
So a young man goes to hospital with stomach pains, is referred to regional hospital, goes there, and they examine him and discover that it's appendicitis. They must
you're trying to be a doctor, isn't it?
Oh, I don't qualify.
Yeah, well, I'm happy you've accepted it. I would have caused you arrest immediately.
So they determine it's appendicitis,
exactly,
and that the appendix has actually ruptured. So as a surgeon with experience, you know that this is what they term in their language dirty surgery, as in it could result in infection. With a very high chance it would result in infection, which comes with its own complications.
Definitely.
I would assume this is something you ought to inform the patient of.
Sure. And
if you fail to do that,
then the patient has a right to take you anywhere.
And would that be negligence or malpractice or both?
I would say that, you see, in this case, you see, there was an inaction. So in the first place, that inaction even is a breach of your professional standard. It's a breach of that duty of care. So you can even take it under negligence.
Right.
Yes.
So,
but again, I indicated that if the patient really was not educated, was not well informed, has that inaction or omission caused any harm? You see, there are standards. So any breach in that standard, calls for investigations, and if the practitioner is found liable, the appropriate sanctions are meted.
So let's continue this scenario. This patient comes through surgery.
Yep.
And is discharged, goes home, comes for a review, and they notice that the wound is infected.
Yes, sure.
So they admit him.
Yes.
And they clean the wound, do the stitching or whatever,
the
close the
secondary
wound.
suture,
Yes.
and all that, yes.
And he is told that the stitches must come out after 10 days. After 7 days, a nurse comes and starts to remove the stitches. So he inquires, we're not up to 10 days. Why is this being removed?
Exactly.
Medical professional, in this case is a nurse, says to him, are you the one to tell me how to do my job?
Kojo,
Yes.
before you even finish your statement, I will consider that completely unfortunate. I mean, you see, we're talking about attitude. We're talking about approach. You see, it does not mean that because I've come to your hospital as a patient, you treat me anyhow. We need a lot of patience for patients, right? You see, the question is, are you the one to tell me how to do my job? If something like this is reported to the Nursing and Midwifery Council and that is established, that practitioner would not have it easy. Because, you see, we have the ethics of the profession. We do not throw the ethics of the profession to the dogs. No. We need to work within, rules and regulations, and we need to have ethical considerations in whatever we do to our patients that come to you. You see, because I continue to tell people that, look, we are all potential patients. The question you ask is, that individual who is treating that patient that way, assuming she were a patient, how would she have reacted if she were told something like that? I think certain things are completely unacceptable in healthcare delivery or healthcare provision.
And this would be one of
This is one of them.
Let's continue the story. So the nurse says, are you the one to tell me how to do my job? And continues to remove the stitches. By the following morning, the wound
opens
is
again.
open again.
Yeah.
So the doctor on duty, a lady this time, looks at it and says, we need to get you back into theater
Sure.
to stitch this up. But,
Exactly.
and this is according to the patient's testimony, I'm in a hurry, so I can do it in the dressing room. So they go into the dressing room.
Wait, so the doctor says we need to go back to theater to get it done. You see, let's take the statements very seriously and listen very well.
Yes.
We need to take you back to theater. However, I am in a hurry. Again, that statement, and takes that patient to the dressing room. Continue.
Yeah. And stitches the patient up again with an assistant. In the process, at some point, due to some difficulty which the patient doesn't know and cannot tell us, the doctor then says, you know what? I should have taken this.
You should have taken this patient to the
theater.
Good.
And then continues, actually, the patient then complains and says, oh, madam, this is dangerous, isn't it? To which the doctor says, please be quiet. In fact, I have added please. The doctor says,
be quiet.
Be quiet. Yes.
Yeah.
and finishes the stitching. So eventually, at the a few days later, when they are going to dress the wound, they take off the dressing, and the stitches have fallen out because the skin is rotting. Let's not forget there is an infection.
Exactly.
So the skin is rotting and the stitches have fallen out. And beyond this point, they treat the infection.
Okay.
Send the boy who now has a swelling, first of all, and a scar. So a few months later, he's come back for a review. The swelling is still there. He feels pain. There is a massive scar on top of the swelling due to the infection and the stitching and all of that.
The process of healing, and definitely, well, unfortunately, okay, you finish up.
So I don't know whether the stitching contributed, but definitely the infection.
Sure.
Yes. So now he comes to for a review some months later, and the swelling is observed by the surgeon, who says this can be corrected with surgery.
Surgery, yes.
But doesn't tell the patient what it is or what is causing it. Simply says, we can fix this with surgery. Come and pay, I believe, 800 cedis since you are on NHIA, and we will do the surgery.
Get it fixed for you. I wouldn't want to narrow it down because there are several things that had happened over the period. From the time that the patient was told that the stitches would be removed on the 10th day, and on the 7th day, somebody had come attempting to take off the stitches. Now, why did that individual come in to take off the stitches on the 7th day and not wait till the 10th day? What was the reason for the nurse coming in to remove the stitches on the 7th day and not the 10th day as earlier stated? Now, that nurse who came in there should have explained to the patient that because of reason A, B, and C, I am coming to take off the stitches. Or maybe the doctor who was taking care of that patient should have spoken to the patient, stating that, we did tell you that we're going to take off the stitches on the 10th day. However, for reasons A, B, and C, we have directed that the stitches be taken off on the 7th day. I mean, it so happens that you have put on certain stitches and you realize that there is a lot of pus under. You need to take off the stitches to release the pus to clean the wound. And you go in for either cleaning over a period and go in for the secondary suturing, which we all do certain times. Now, the way the nurse retorted, well, as I indicated, was unfortunate, was unacceptable. The patient was not educated as to why the stitches were going to be removed on the 7th day and not the 10th day. That was also unfortunate. The other part that went in again was that the doctor did indicate that I should have done this in the theater. If the doctor had indicated that, unfortunately, we have an emergency and therefore the theater is ready, we can accept that. But for the doctor to say that I am in a hurry and therefore I cannot take you to the theater, therefore let's whisk you to the dressing room for me to do it, that is also completely unacceptable. It does not meet medical standard of practice. It does not. Now he went further, and he himself in the course, you see, because we haven't done any investigations and therefore cannot really establish the facts of this case, we are just using hypothetical scenarios. And I would wish that the listeners that we are talking to would also take it that it's a hypothetical scenario.
Yeah.
You understand? So at the end of the day, right, because the doctor had also whisked the patient to the dressing room to go do that sort of suturing, which he himself or she herself had consented to the fact that this should have been done in the theater, again, there was a breach. And therefore, that standard of suturing cannot be met. I presume you have been to a theater before, and you know how the setting is and what you can do in the theater. Certain times you even need the lighting, which might not even be available in the dressing room. You need certain position of the patient, which might also not be available in the dressing room. You need certain amount of, the environment itself, which might not be available in the dressing room. The materials you are going to use, the equipment that you are going to use, the forceps, the needle holders, and the pairs of scissors you are going to use need to be at a particular level of standard, which might not necessarily be available at the dressing room. So again, there are issues. Now, getting forward, we indicated that then the patient went home. Eventually, the wound healed, and the patient came with a swelling. I don't want to go through the processes of surgery, but again, it so means that, there is a defect, right? If it is the abdomen, there is a defect in the fascia, right? In the, I would have wished I had another word to describe the fascia.
That tough lining that comes before the skin.
Exactly. You understand? So if there is a defect in that, then definitely any organ or anything that is below that can try to come out. You see, and that was because there was an earlier incision which really did not heal as it was expected to have healed, and therefore there is an incisional hernia. You understand? Now, if the patient came back, right, I agree that that patient developed the incisional hernia secondary to the earlier surgery that was done. But again, the incisional hernia would have come as a result of the original or the initial problem that the patient had. The patient had an infection, and that manifested all along in the course of the treatment. And therefore, under normal practice, or even if the standard had been met, there was a possibility that that patient would have developed an incisional hernia. The only places that I wasn't comfortable with is the fact that the nurse has retorted, the doctor had indicated that I should have done it in the theater, but yet because I was in a hurry, I had it done in the dressing room. These are things that, but they might not be necessarily be the cause of that incisional hernia. The underlying cause would have been the earlier infection of the ruptured appendix, which would have come with all the infections and others, which really had manifested. But again, you see, when issues like this happen certain times, we are only interested in what would have happened. You see, that is why when we were talking about negligence, and I talk about standard of care, I owe you a duty of care. And that standard of duty that I owe you is higher, is considered. These little things, which would really contribute to, establishing that standard of care, are things that are manifested. So eventually, or invariably, that individual developed an incisional hernia.
I want us to take each act on its own and see whether there is negligence or malpractice implied. So, for example, the patient not being told that the appendix has ruptured, therefore this might lead to an infection. That single act, would you consider that to be negligent?
Yeah, it's a duty of care. You have breached it. Because you see, the patient is supposed to have understood what exactly was happening to that patient.
Okay. The second one, the nurse removing the stitches on the 7th day without explaining to the patient why that is being done.
It's negligent. The patient was supposed to have known what you were going to do on him or her.
Okay. Third, the doctor not taking the patient
to the theater but rather doing the secondary suturing in the dressing room.
Yeah.
Again, there was supposed to be a standard of care, and that standard was not met. That standard of care or that duty of care was breached.
Fourth, the patient being told that the incisional hernia can be treated,
yes,
but he must pay for it. But actually not being told that it is an incisional hernia or having any explanation given to him about why he has a swelling. Simply being told, your swelling can be fixed,
however,
pay money.
Yeah, you see, there are two issues here. Even if the patient were told that you have developed an incisional hernia, again, you are paying money for the surgery to be done. And there are consumables that go into getting that surgery done. And therefore, you need to pay for those consumables. That is well understood. You understand? Now, let's look at the fact that the patient was not told that it's an incisional hernia. You see, you cannot just get up and take a patient to theater without the patient really knowing exactly what is wrong with the patient and what procedure you are going to do.
That's very clear. I think you've really educated us here.
Certain times, you see, whilst we also agree that
and that's just a little bit of what happened when I met with Dr. Eli Atikpui, who is the Registrar of the Medical and Dental Council. So much more of this. Stay tuned to the Joy News channel, and we will be bringing that back to you at a later time.